Well, we had a very good meeting of the ILCC, the International Lung Cancer Congress, our 21st meeting. I've been leading it for many years now with David Gindera. This year, Dr. Heather Wakely from Stanford joined us as well. Really a great 3 days, and in this era of COVID, there was so much discussion because we really had many panels and the meeting was entirely done live, except for a few of the presenters from Japan and Europe because of time zones. I talked about next generation agents in lung cancer. And what did I talk about? Well, I think you can't think about the new agents in lung cancer without thinking about KRAS and the G12C agents, the Amgen 510, which has been studied in lung cancer. Some very exciting data for that, showing response rates in lung cancer with very reasonable durations of survival and response. And then, of course, the data for the Mirati drug as well. So that's certainly on the top of everyone's radar. Of course, we're very interested in what's going to happen for immunotherapy, especially in patients with either primary or acquired resistance. For that, I talked about combinations of anti-VEGF agents with immunotherapy, talked about the pembrolizumab and plus ramucirumab, a VEGFR2 antibody plus a PD-1 inhibitor that we're studying in the Lung Master protocol, the Lung Map. In the Lung Map, patients who have had immunotherapy and failed can go on to get this combination arm, and those studies are progressing quite nicely. Also looking for new targets. Not every patient's going to have a tumor with high PD-L1 and with lots of tumor-infiltrating lymphocytes. Sometimes you find that there are many tumor-infiltrating lymphocytes, but no PD-L1, suggesting other checkpoints might be in play. And I talked about some work we're doing as part of our Yale Spore and lung cancer, and a phase 1 trial being conducted by a company called NextCure, of which Dr. LaRusso at Yale is one of the investigators, looking at Siglec-15. It's an antibody against another homolog of PD-L1, another checkpoint, showing some early data, showing some responses in lung cancer, and some very long-term stable disease. So the bottom line is we need alternative targets for immunotherapy and new targets against known genetic drivers such as KRAS, which has been the holy grail and eluded us for so many years.